When my husband died, 2 years next month, I started losing my voice, which terrified me. It was sort of, I get up and I try to sing and go, My range was gone. That's what it was, mostly my upper range.
I will be there. New sounds. Perfect, darling.
The voice is our most exquisite messenger of emotion. That is true under normal circumstances. We can convey in a moment what is in our hearts. You can pick up the phone, hear your mother on the other end, and need only the word hello to know where her spirit is.
People often describe when they're going to cry the feeling of their throat tightening. So that can also be something that then comes out in the voice as well. In a way, our voice expresses things that we don't even mean to express necessarily, and I think probably only very well-trained people have their voice do exactly what they want it to do at any given time.
And of course, we've also begun to change America's image in the world.
Awesome! Yes, I'll sign for that. Thank you very much. Oh, Lord.
Hello?
Their state of mind, meaning like your stress level, how much energy you have, your subjective mood or experience of the world definitely will affect your body, such as like your appetite, your energy, your focus and concentration, even your immune system to fight off infection and disease. So I definitely think that there is a connection with mind and the voice.
How the mind has power over the voice is a question I ask myself a lot. It's the focus of my research. You know, by what pathway or what mechanism, how do we get from here to here?
Does the mind have control over the voice? I think it has a lot of control over our sense of communication and phonation. When your body is experiencing stress reaction, whether it's good or bad, one of the things that happens is your stress affects your whole body. And that inevitably will affect your systems of speech, which are respiration, phonation, articulation. Another aspect of stress that has an effect on your voice is the biochemical reaction. So you may have less hydration to the vocal folds.
There's the very basic fight or flight response, where someone stays in a permanent state of stress or escalates their stress reactivity very abruptly. And that's the part of the nervous system that will lead to dry throat and dry mouth and muscle tension and those things.
Stress manifests differently in different people, and so sometimes stress can manifest as muscle tension specific to the larynx itself. Sometimes the stress can manifest as discoordination between the upper airways, including the larynx, and its coordination with the lower airways, the pulmonary system.
Some people react to the stressor by holding their breath, so shutting off the airflow to the voice. In that sense, it becomes harder to speak. For some other people, it may not be so much that they're holding their breath, but that they use more pressure below their vocal folds to produce voice. So they may have a tendency to produce louder voice potentially, or more forceful voice, like in heart glottal attacks. So that could be more phonotraumatic, potentially due to vocal folds.
Mind and voice are very connected. It's impossible to deny that reality. And so as a voice teacher, I have to be aware of that. And on some level, as I'm focused on the technical needs of a student, which involve awareness of resonance, mindfulness of breath, I have to see where they're locked up, why they are not able to unlock their voice, so to speak. In that setting, it's inevitable that you're going to uncover some issues that they've had in their life. Some minor, some much more minor than others, and some incredibly devastating.
Trauma can be expressed in the voice not just acutely, but for years. We have expressions all choked up, for example, which are common knowledge recognitions of the link between emotion and the voice.
I've noticed that many trauma survivors show indications of the trauma in their speaking and/or their singing voices.
The arts have made reference to psychological trauma and voicing. You can look all over in Shakespeare and find lots of references to trauma, for example, grief trauma. Grief is certainly a trauma. In Hamlet, there's a whole soliloquy with the physician about whether the physician might not have some sweet antidote to this grief. And the physician says, therein the patient must minister to himself. And so it is. In the 1970s, The Who produced its famous rock opera, Tommy. And in the opening scenes, 3-year-old Tommy witnesses looking in a mirror his father, who's returned from World War II, murder his mother's lover. His father was thought to have been lost in the war, but returns. And he says, what about the boy? He saw it all. And then there is a whole exchange where the father sings and Tommy echoes the singing. You never heard it, you never seen it, you know nothing about it, you'll say nothing about it never in your life. And this produces the deaf, dumb, and blind kid who sure plays a mean pinball. And it finally takes some psychological interventions that we would now say were behavioral to break through the way that little boy at around age 3 stored those memories in his mind. That's a perfect art example of a conversion disorder, because there was a powerful state-dependent memory that was created that went in and did a pretty directed post-hypnotic suggestion in the state of a traumatized listening child. To say, you'll say nothing about it ever in your life, which then generalized to mutism in this child.
So someone might be describing something very confidently and very angrily and with a lot of bigness in their voice that all of a sudden disappears and they become very quiet. And they retreat and it's as though they've shrunken. So they might go from very big to all of a sudden this soft, quiet, not coherent voice.
When she first came, she would regress and go into this, it was like an altered state. Her voice was so soft. Her speaking voice was also so soft I could barely hear it. She was so young, and her singing voice was like a little child.
People returning to a different psychological state, one close to where the trauma was.
Why do you have to do this?
Give me a break.
People's voices changing in ways that are consistent with a much earlier age. So someone sounding like a little kid and not being aware of it and not trying to be cute or funny, but sounding like their voice is taking on a higher pitch, and there's sort of a roll to the cadence that sounds much more like a little kid voice. And that may mean that their voice may take on if they're remembering or reliving the trauma, sometimes it can take on that shrill, tense component that we think of as being associated with acute horror.
When a person is overwhelmed by either experiencing directly or witnessing some event that overwhelms their coping mechanism, that traumatic response is installed or reactivated in a person. And it affects every organ system, including voicing. And it would be inescapable that the voice would be affected by any traumatic event that affects the body in that profound way.
One of my students that I had years ago was singing in choir as a bass. And when I first met him, I noticed that there was some interesting sounds coming out of him that seemed perhaps disingenuous in a way. So I was just listening and thinking, is this person doing something to their voice that is unnecessary or maybe masking something? And as we were uncovering things, the tessitura, which is just the average of where your voice should lie, either low, middle, or high, was much higher than I would have thought based on his description of his voice and based on the way he kind of led with his voice. I thought, okay, so what's happening here? And as we uncovered that, he was very uncomfortable with that. And I don't sing that high, and I can't sing that high, and that's not, that's just not me. So as it turned out, this student was abused on multiple occasions, sexually abused during his childhood. And he had not shared that with anyone.
She came to me because she had an image. She was in another kind of therapy. She had this image of a scream stuck in her throat. And she knew she had to work vocally, that was going to be the solution to get to the feelings of sexual abuse.
I remember one particular instance of a young woman coming into the office. She was a professional singer and a flight attendant and very put together, poised, quite beautiful. During the evaluation process, she had to have her vocal folds looked at. We were engaged in a procedure called a video stroboscopy. And that is where you insert a camera into either the mouth or the nose. In this case, it was a mouth. And one of the things that struck me was how easy she was to work with and open. And I had her lean forward and stick her tongue out. And the minute I put the scope in her mouth, she went into a tremendously panicked state. She pushed me away, ran around the room, kind of pulled her hair out and crouched in the corner. I was petrified because this had never happened before. She came back to the table after a few seconds, and I asked her, would you like to talk about that? And she said, when I was a young child, my uncle forced me to have oral sex with him.
If there is some type of emotional blockage, it's going to show up in the voice in many different ways. One of the most common is tightness in the voice. And so a person's voice will just be very tight as they're speaking or singing, and their ability to release breath comfortably is robbed of them. The signal for voice goes through many different areas of the brain and definitely involves the emotional center.
When human beings experience distress, whether the stressor is external or whether there is an internal re-experiencing of some physiology that reminds the human of that experience, the brain is immediately activated. And we know that stress responses come in two pathways. There is an immediate, instantaneous, and old brain pathway that comes through the limbic system with the amygdala and the hippocampus. And that triggers an immediate association between memory and emotion that's stored in that old evolutionary brain. At the same time, but in a more complex pathway and with a slower response rate, a signal goes to the frontal cortex, which brings in all of the executive function components that allow the human being to assess that threat or that perceived threat and to understand whether it really is life-endangering or not. Nonetheless, in the meantime, that whole limbic system has kicked the physiology of the stress response into action. So the hypothalamic pituitary axis is activated, cortisol releasing factor has already been activated, and so all the target organs in the human body are already preparing to either fight or flee. Or alternatively, if it's a parasympathetic branch response, to freeze or faint. Both of those responses were designed to be survival mechanisms, but both of them flood the organism with chemicals that affect all the organ systems of the body. They're wonderful if you need to freeze and be invisible so that you're not eaten by a predator, but they're not at all helpful if you're trying to have the smooth integration of neuromuscular responses and respiratory responses to produce voice.
Trauma affects vagal tone, and that then can affect the voice. The vagus nerve starts in your spine and runs through your body, and it's connected to a couple different things that are central for emotional presentation. One, it's connected to the very front of your brain, the prefrontal cortex, that has to do with your ability to organize and speak coherently and linearly. It also has to do with the ability to inhibit or control your emotions. That wire, the vagus nerve, is also connected to a part of your brain called the insula, which has to do with body awareness and feeling sensations in your body. And then that also has to do with a part of your brain called the cerebellum, which has to do with the idea of targeting. So how big or small your response is and whether you can match having a big or small response when that's what you're trying to do. So this nerve, because of these functions related to self-control and body awareness and targeting, this nerve integrates all of those functions, and what that then leads to is the ability to have a regular and predictable prosody and rhythm and expressivity and inflection in your speech and in your voice.
One patient, she had hoarseness in her voice, a soft tone. They couldn't figure out what it was, and as I got to understand what was going on, she was under a lot of stress at work. And I'm going to sound a lot like a shrink when I say this. Awkward difficulties with a very overbearing mother, and she wasn't able to talk about this. And as we discussed this more, we found that actually her voice became more richer and began to return.
One case that I dealt with in the clinical setting was a young 12-year-old gymnast who was experiencing abnormal vocal fold movement when she was doing her gymnastics. The vocal folds were shutting and closing when she was trying to breathe. She was getting a lot of input, let's say, from her family. They were motivating her a lot to the point where it was affecting her ability to perform because she was feeling very stressed from these high demands that her family was placing on her.
In a fundamental way, trauma is about the loss of the voice. What happens in trauma is that someone has disregarded the other person's wishes. They've overlooked their voice. And people take that on when they're traumatized. They take on their inability to speak.
The cases I do remember usually revolve around domestic violence, and patients are almost always female, and they're very protective of their voice. They usually present with an absence of voice, and there are different tricks that we can do to try to bring out their voice. Usually these patients can still swallow, they can still cough, they can still breathe. So the other functions of the larynx are still intact, but they just lose the voice. One case that stands out is a patient who was strangled from domestic violence. And I remember when I first examined her, she was very protective of her neck. And then when I had to scope her, she actually pulled out the scope. And she had psychogenic voice disorder where she lost her voice. There was nothing anatomically wrong with her voice, but after the trauma of being strangled, it was just very difficult for her to phonate again.
Stressful event or interpersonal conflict, problem with superiors or husband, wife, spouse. This caused difficulty with the voice. We had some cases, a few cases of people who were assaulted, who had someone break into their car. We had a patient that had to shoot someone during her job as a soldier who lost her voice as a cause of that. Definitely, we see this very close relationship with the voice and the psychological state.
Oftentimes, many of my voice patients, I'll get referred a patient from an ENT office or a laryngologist. Well, they won't have found like a physical factor adversely affecting the voice.
There is psychogenic dysphonia, psychogenic aphonia. We know that there is puberphonia and selective mutism and a whole range of those kinds of responses. But in conversion disorder, there is the absence of functional disorder in the vocal tract itself. We can see in non-voice voicing maneuvers like coughing and laughing that the vocal folds do come to the midline and AD duct.
We noted there are a few patterns of the laryngoscopic characteristic during the examination of the vocal cords. The vocal cords are essentially normal. There's no disease in the vocal cords. Their structure is normal and the function is normal. But there's a use of additional muscles that are not essentially the muscles of the vocal cords themselves, but muscles around the vocal cords that come into play and act when they're not supposed to act. We hear many times what we call a stressful whisper, and then there's like someone is strangulated.
I started losing my voice. So I went to this voice specialist and he did all these tests. He said, "Come look." And he said, your vocal cords, your vocal folds are perfect. And I said, but that can't be right because I can't sing. And he said, you're the music therapist. What do you think about this if it was a client? And I said, I'm grieving.
One instance that comes to mind is a patient that came into the clinic. He was a 75-year-old individual who had a sudden onset of a voice problem. And typically when we see older people in the clinic, we start thinking of age-related problems. It turned out that his problem came about a couple of days after he attended the funeral of a very close friend. Everybody goes to funerals, so why would he have this voice problem? But this particular individual who died had gone through a Japanese prison camp with this patient. And it was the last link between this individual's highly traumatic past, and it forced him to face something that happened a long time ago, that he developed this voice problem because he now didn't have anyone he felt like he could talk to.
The patient believed that her children, the parents of the child, were holding her responsible for not protecting the child from whatever stimulated the asthma attack in the first place, and that she and her husband may not have done everything humanly possible to save him. In point of fact, the parents did not believe that, but the patient had absorbed that sense of responsibility. Her style of coping was to be very strong and to hold it all together, to keep it all together, and not to let anything interfere with her ability to care for her family. So she took all of that grief, all of that stress, all of that guilt into her body, and she had a strangled, strained, whispered voice. And it was in a speech pathology, initial speech pathology evaluation, she began to talk about this story to the speech pathologist in response to his question about whether there might have been anything in her life that might have made her sad. She began to sob and could not go on. Her husband told the rest of the story, and as she sobbed and sobbed, her diaphragm went down. She was able to take a fuller breath, and there was louder voicing.
This person came in and she talked so fast. It was like, I mean, it's like I couldn't take it in, and I couldn't get a word in, which was part of, I think, the defense. I couldn't get a word in. And her defense was she couldn't breathe.
Trauma leads to a disconnection between things that are normally connected to one another. Your ability to feel, with your ability to think, with your ability to communicate, with your ability to plan.
I need to speak up to my boss, but I'm frightened of losing my job or losing my position in the company or losing that pet project I want. So this concept of the conflict is huge. That's one area where I do see a psychological factor influencing voice function. I call that driving with your brakes on. So they want to speak out, but they can't, so they check themselves.
The corpus callosum connects the left and right hemispheres. And broadly speaking, very broadly speaking, the left hemisphere in right-handed people is more related to language production and logic and linear thought, sort of a more mathematical part of the brain. And the right hemisphere of the brain is more related to sensation and emotion. We think of that as sort of the more artistic part of the brain. If the left and right hemispheres aren't sort of communicating properly, then someone won't be able to use their language to influence their feelings, and they may not be able to put their words into feelings, so that communication is broken down. We think that part of the brain is heavily impacted by trauma, particularly by childhood trauma, and seems to be fairly impacted by neglect. And one of the reasons we think neglect may be salient is that what happens in neglect is, or what happens in appropriate childhood development, is that parents teach their children how to connect their language and their feelings. So they see their baby crying and they say, "Oh, you're so hungry, let's get you some food." Or their child hurts their knee, skins their knee, and they say, "Oh no, you fell." And they put words to those tears. In the case of neglect, no one is doing that. No one is serving as helping bridge between the language and the understanding of cause and effect with the emotional experience that someone has had.
One way of alleviating the symptom of a psychological stress that's manifest in the voice is to kind of help the patient get in touch with their feelings. The problem is these are often difficult feelings, and so patients might resist that and insist that it's my voice, it's my vocal cords, it's my larynx, it's not that I'm going through this difficult time or I've lost an important person in my life.
I think the hardest part about treating someone with a psychological history or traumatic background is staying within my scope of practice. I'm a speech pathologist, not a psychologist or a psychiatrist, and so making sure that I am not going beyond my boundaries as a professional.
Integrating voice therapy into a situation where there's a heavy psychological component really isn't a challenge. It's more a skill. The challenge is acquiring those skills to deal with that aspect of voice. We don't just treat a larynx in therapy, we treat the person.
In voice therapy, we give patients tools so that they can be their own therapist when they leave the therapy room, even every time they leave therapy, but then also when they are discharged, so that they can be really in tune with potentially early warning signs or their own individual warning signs of changes in the voice, be it a slight change in aching in their neck, or that the voice falls backward, or becomes tense.
And for me, as a clinician, first comes the viewing, and then comes the doing. So whether I'm trying to work with a patient to change their way of viewing or their way of doing, spend some time understanding how they're viewing and then what they're doing in order to be able to help them structure some way to respond differently.
If a therapist thinks that a person is having a lot of emotion, their voice might get calmer and slower and more regular.
We work a lot with the breath, natural sounds or primitive sounds, singing, and vocal improvisation.
Someone's voice may start to deepen, become broader. We see an accompanying change in physical posture where the person opens up across their chest and across their arms and is more able to take up space.
So seeing these people grow and change, hearing it in their singing voice is so important. And hearing it in their speaking voice.
If one's unable to release their breath, then they won't find their authentic voice. So if there's a psychological component that's interfering with their ability to breathe deeply and release breath, then they will have some type of voice issue.
put a lot of judgment, I find, on the stress or the anxiety that leads them to have a voice disorder. And there's a lot of, I think, kind of internal narratives that people carry with them about, I shouldn't let this stress me out so much, and I shouldn't be so anxious just about talking to my boss, and I shouldn't let this person bother me. And because they feel that they shouldn't let this person bother them, they don't acknowledge that this person does, to the point where they have a voice problem.
Self-imposed stress and anxiety and high expectations comes from a childhood experience of invalidation, maybe even neglect, or feeling like they were never good enough. And so that kind of loads on to their expectations of themselves, which can create more stress and more anxiety in an already difficult career.
I've had many students come in with the, I don't know whether it's that common, I think it's fairly common. They have a story from their very early childhood where they were told, as they're singing in a group of children, that they need to mouth the words. Because for some reason their voice was jumping out of the fabric of, maybe they were out of tune or something like that. And they were told at a very young age, very impressionable age, that they should be quiet and mouth the words. And I actually have 2 current professional students that had that. And there are still effects at age 40-something. From just the early onset of being told, your voice is no good.
A 40-year-old female. The patient came to us with a long-standing history of voice problems, and it was determined that her voice problem was attributed to muscle tension dysphonia, which is a functional voice problem. Some say that it's a psychogenic in nature, which hers actually happened to be, but we didn't know at the beginning of her therapy session.
When the light strikes raindrops in the air, they act like a prism and form a rainbow. The rainbow is a division of white light into many beautiful colors. These take the shape of a long round arch with its path high above and its 2 ends apparently beyond the horizon.
And after this patient wasn't making progress in her therapy session, I started to question maybe what was this underlying aspect? What was going on with the voice that maybe I wasn't familiar with? Because the patient wasn't making the progress that most people do at that point in their therapy. And it was at that point during that session where the patient disclosed to me that as a child she was actually locked in a bedroom for days at a time, not able to speak to anyone, because her family told her that her voice was ugly. And it was only when she sang that her parents would tell her her voice was beautiful.
One of the most rewarding aspects of my work with particularly singers is oftentimes they struggle with, oh my gosh, I am my voice, and I encourage them to consider that they are much more than their voice. They're full, complex, complete people that might be going through intense feelings, and I try to help them through that. Many of my patients have spent a lot of time trying to impress, whether it be like a family member or an audience or whoever, and they'll get through that and accomplish quite interesting and impressive things, but they will be left with a feeling of unfulfillment. What I enjoy doing with patients is encouraging them to actually work really hard to impress themselves, and I think that's very valuable.
Making sure that you positively reinforce a person's impression of their voice, their joy of singing and making sound. I think over time then you can override that response of fear of sharing voice.
I think the most important component is to increase the awareness of the stressors or influences that traumatic events can have on a person's life. Very often it's these psychological events or stressors are the norm for that person. And so the person isn't aware that how much impact these influences can have on their body, on their system, on their voice.
The throat, in my eyes, connects between the mind and the body. Our feelings, they show through the face, they show through the eyes, but they definitely show through the voice.
It is essential for us to recognize and address the psychological etiologies of their vocal personality projections if we are ever able to help them restore their voices to where they want them to be, and in so doing, help them restore their personalities and their senses of self.
If I can make a sound when I cry, how can I not speak?
What's happened socially, because traumatized people may struggle with using their voices, society may forget that traumatized people are there. And so it's our job to listen in the silences and find the sort of quiet places where people who are living with trauma and help them find their voice.
And I said, I'm grieving, and maybe I'm not letting myself grieve enough. And he said, yeah. He said, I think it's like I needed to cry. I just needed to, which happened. I went on and cried and cried. And my voice came back, you know? So I was holding so much in there. So, yeah, that's my example of a trauma that affected my voice.